All right, Alex. So I was wondering, thinking back to last session, you were telling me a little bit about your dad and some of the more traumatic or troubling memories that came up. I was wondering if you'd be willing to go there with me again today.
Sure, yeah.
Okay.
Yeah, I do want to talk about some of that.
Yeah. Has there been anything that's been especially heavy on your mind or that you've been thinking about a lot recently?
Yeah, I've been thinking about him just like as a kid abusing me, honestly. A lot of stuff about like him hitting me when I was a kid or like being really like nasty to me whenever we would play. I would play a sport. It's a lot of abuse as a kid. It's really difficult, and I just like it just makes me feel terrible. Like I think about it all the time. Just the thoughts of the things that he did when I was a kid and like the things that like came up are just so overwhelming all the time for me.
Yeah.
Yeah.
And who did that, like, what kind of a figure or character does he play in your mind now because of that?
He's kind of like, he's just someone I don't like consider in my life anymore.
Yeah.
Like he's just kind of there, but I don't have any respect for him or like any positive association with him at all.
Really?
So,
None at all?
No, not any. Yeah.
Okay. Yeah. Why would that be? Would you mind telling me a little
Yeah,
bit more?
sure. I mean, he just the way he behaved when I was a child was so negative and like so abusive, poorly held together, emotionally immature, just awful as a kid
Yeah.
that like I can't even begin to like the examples I have for why he was a shitty parent are so numerous.
Yeah, yeah, and we don't have to go into them right now. And I'm noticing that, going into this is a little bit activating or triggering, which is totally understandable because of the traumatic nature of it. So I'm really thankful that you were going there with me, and I'm wanting now to kind of pull it back and bring back to the present moment, get back into our bodies, take some deep breaths.
Sure.
Remember that we're here in this session. We're not at that place anymore with your dad.
Sure, thank you.
How do you respond to that kind of, like, I guess, going back, doing a little bit of talking about the trauma and then coming back to now and remembering that it's not happening anymore?
Yeah, that was helpful. I could feel myself getting really like into it and like overwhelmed.
Okay.
So you like bringing me back, I really appreciate that. That's like a really calming and helpful presence.
Yeah, I think, we can go back in, but we can just do a quick, if we want to get our feet flat on the floor.
Sure.
And just take a few, sit up straight and take a few deep belly breaths and in through our nose, out through our mouth, in through your nose, and out through your mouth, in through your nose, and out through your mouth. Maybe noticing the floor, maybe noticing the sounds that are in the room with us. Okay. How do you feel now?
More grounded. Thank you.
Yeah.
That was very helpful.
Yeah, so, using that, that could kind of be a structure that we use going forward or a framework rather, that, we do a little bit of trauma and then we try some of those grounding exercises like that.
Sure, that'd be really helpful. Thank you.
Okay, yeah. Do you want to continue, or do you think you're ready to tell me more?
Sure, absolutely. Yeah.
Okay.
Would that be okay?
Yeah, let's get into it.
Yeah, sure.